weeks, Doc, have talked about, the one consistent message has been like moderation. And I know for people that say, I'm going to save all of my resolutions until the beginning of the new year. And, I'm going to get past, I got family obligations, I got work obligations and everything. Once the holiday's over, I'm going to take a great big swim in Lake Me, right? I'm going to like basically turn my life around. But they also tend to overcommit themselves and over obligate, and they take on way too much and everything like that. So when it comes to moderation, maybe talk to us a little bit about making small little achievable goals instead of basically trying to build Noah's Ark within a month.
Yeah, right. And for me, and I've heard people say it before, one of the easy suggestions is just to cut everything in half. I think that's a great suggestion. And then again, just a half a pound to a pound a week. That should be the short-term goal if you're looking at weight loss. And that equates to about 50 pounds in a year, right? And that slow, steady weight loss tends to give people more or better long-term outcomes as opposed to just the crash dieting and all that stuff. Yeah. So yeah, just half a pound to a pound a week, making sure that you stay on track and making sure that you have that support to be sure that you're successful in your mission.
Doc, can you kind of maybe elaborate a little bit on what type of weight loss is maybe unhealthy? Because just looking around, I see some of my friends, they'll go on like for example, the keto diet, right? And you'll see this crazy weight drop, and then I'll be like, hey, what kind of working out are you doing? You doing exercise too? And they're not. And so what you have is this like tremendous weight loss without like an accompanying. I mean, I don't know. I feel like exercise helps just build everything up. So how would you address like that type of situation where people are maybe a little too obsessed with losing the pounds at the expense of everything else?
Right. I think that's a difficult question to answer just because everybody's different, right? And when we work on weight loss and dieting, not everything fits a particular person, and we really have to individualize our care. And so that's why I think it's important to see the experts and figure out what works for you and not what works for everybody else. Because a lot of things that people pursue are things that they read on the internet or things that they just hear about, right? But a ketogenic diet might work well for one person and be totally detrimental for somebody else. So just doing the research, seeing the right people to make sure what it is that you want to achieve, and how to achieve that is right for you.
Is it a struggle to get people in to do their numbers work, their lab work, to find out like exactly where they're at? Because I mean, that was a struggle for me. I went the whole pandemic without going to the doctor. Finally did, and I was like, oh my God, wake up call. So how do you kind of like reach out to those patients and be like, hey, you really need to like check where you're at right now so we can determine how to move forward?
Yeah, it's funny you bring that up, and it's not only a struggle, but it's critical in why we see so much chronic disease on Guam, is because there's a culture here that has been created that prevents people or from wanting to come and see a doctor, right? And so people not wanting to come in to do an annual physical, for example. I see some patients who've never had a physical their whole life, and they're in their 40s, 50s, 60s, and that's with chronic diseases, a lot of the times they're silent diseases, and it's not until they become really bad that you actually start to experience symptoms. So it's critically important for people to come in at least once a year to do a physical. There's so much information that can be obtained from a physical, everything from the blood work to cancer screenings, right? That all occurs at a physical, and it's just getting their foot in the door that will set them down that right path and determine the follow-up after that.
Can you talk to us, Doc, about like the secondary parties involved in like the treatment of a patient, right? Because like here on Guam, we're such a family-oriented society, and when one of our family members like gets sick, very often people won't mean any harm, but they'll continue to eat the way they eat. Like if someone is diagnosed for diabetes, and it's hell on earth for somebody to say you have to change your diet, and yet you see people eating beef shank or or the ham hocks.
Easy, bro.
and like when Chris had his diagnosis and everything, we made sure here, the rest of us in the studio, we're respectful to that and eating that, because we wanted to be nurturing and motivational and everything. So when you talk to patients, how do you also address their families and say, this is a way that you can all go through this together?
Right. And it's hard because in the clinic you're usually in a one-to-one setting. and you don't get to go into the home environment to see what other factors there are that influences that change. So I do try to encourage, some families I do see the entire family, and for others I don't, but I do encourage people, whether it's a wife or a husband that comes in, to also get their partner involved. I think a lot of it has to do with a behavioral change, as well as a cultural change. And this is a really, really big topic. And I focus a lot on prevention. And I think there needs to be a cultural shift with the entire island and the families and how we set certain examples. Because I think, it's the core of why we have so much medical illness here on Guam. But it's difficult. Again, it has to be individualized. But I do always encourage my patients to have that support, because they're going to need it. Again, diet and exercise is no joke. It's really a tough challenge. But once, again, with reinforcement, a lot of times once people start seeing the results, they tend to stick to it, and then they get other people involved within the household, and then that just leads to a healthy family.
Yeah, healthy domino effect.
Yep.
Right. Doc, can you talk a little bit about inflammation?
Inflammation?
I mean, I guess, yeah. Is that a big issue here on Guam and just generally?
With regard to diet, or just in general?
I guess in general.
Maybe as part of like as a symptom, or like the way people the food they take in, like whether they exercise or not, like and that wind up being a byproduct.
I hear Doc. I hear a lot of people dropping. It's like one of these, buzzwords that people are like, we need to promote wellness. We need to talk about inflammation because it causes so many other things. So, I mean, as a layperson, I don't really know about it. So that's why I'm asking you.
Yeah, inflammation definitely plays a role in many diseases, and a lot of it is environmental. So diet for one. You see a lot of people with gout here on island, and some of the worst gout I've ever seen. A lot of it is related to the foods that we eat and lifestyle choices. Inflammation usually presents with pain, rash, that kind of stuff. But there are so many factors that we have to take into account when it comes to inflammation. Some inflammation is inherited. So you hear about autoimmune diseases like lupus, rheumatoid arthritis, which is also psoriatic arthritis, which is also very surprisingly prevalent here. Because when I was in California and Arizona, at least the practice that I was in, I didn't see a lot of inflammatory conditions, definitely not as much as I see here. So I definitely feel like the foods that we eat trigger inflammation. It's been well studied. There's the concept of leaky gut syndrome, causing inflammation in the gut, and then that releasing toxic chemicals that affects whole body inflammation. Is a big topic of research in medicine nowadays.
Whoa, leaky gut syndrome. Now I'm paranoid. Yep. I don't even want to Google this.
Yeah, look it up. It's interesting.
So, Doc, when you talk about the diet, is it just the sodium basically that's causing inflammation, or what is it in what we eat?
I think it's everything. I think, there are certain pro-inflammatory foods out there, beef, eggs. A lot of people have certain food allergies. Sodium, affects blood pressure. High carbohydrates cause diabetes. Diabetes can cause microscopic and macroscopic inflammation in the blood vessels. So it's a really, really complex system, and everyone is different in how they respond to certain foods.
Mm-hmm. What are the most common types of cases that you see, like around this time? Maybe starting at like Thanksgiving, heading all the way up to New Year's.
And I do internal medicine. So the most common diseases here on Guam and in the U.S. are of course cardiovascular disease, heart attack, stroke. Cancers, diabetes, end-stage renal disease. Those are the big ones on Guam. When I came back in 2013, I worked as a hospitalist at GMH, and the amount of chronic disease that I saw at the hospital was shocking. And not only the amount of disease, but the severity of disease that came through. Young people with premature illness. It was crazy, and just knowing how much suffering our people were going through because of this type of disease, it was, personally, it was troublesome to me because a majority of this was preventable. And so I made the switch
Lifestyle based, right?
Yeah.
right. And so I made the switch from doing inpatient medicine to outpatient, with my primary focus being on prevention now, and trying to prevent people from getting sick, trying to prevent people from getting hospitalized, and trying to give people and their families a better quality of life.
All right, so let's maybe you could just reel off some ways that we can do that, Doc, as the new year approaches.
As again, like you mentioned earlier, it's just getting your foot in the door, doing an annual physical, and seeing your doctor, because there's so much that you can pick up out of that one visit. Again, with chronic illness being such a silent disease, early detection is key. Early detection leads to early intervention and favorable outcomes. And I can't stress enough the importance of early detection. Yeah.
All right, so Doc, any final thoughts you'd like to pass on as we head? We basically put the year 2021 in the history books, and we begin a new chapter, a new year, and everything like that, and hopefully a new perspective on health.
Yeah, I mean, with the pandemic and everything, I just want to encourage people to make healthy choices, to stay as healthy as possible. Again, just seeing your doctor regularly, because early detection is key, and we all know what puts us at risk for COVID related complications, and that's the big ones, the diabetes and heart disease and all that stuff, and who knows when COVID is going to end, and COVID is not going to be the last threat to us and to our health. And so I really want to change the trajectory of chronic disease on our island, change the culture of unhealthiness here, and it's I'm encouraged because I'm already seeing those changes happen. I think, Jason, you mentioned in a show previously how much people you see exercising in Tumon, right?
Mm-hmm.
And we're already seeing people become more mindful of their health and making those small changes that are going to make a big difference. And even in the restaurants that we eat, specialty items on the menu that allow for healthier options, the whole farm to table movement, I think we're already moving in the right direction. But we can do more, and just education. I think we underestimate the power of messaging and educating the people. And I think people did a very good job messaging about coronavirus and all that stuff. But I hope that the messaging about chronic disease can be just as much present, because chronic illness continues to kill millions of people every year in the U.S. So that's my hope. I think education's key.
Thank you, Doc, so much.
Yeah.
Good talk.
Yep.
All right,
Thank you,
FHP,
All right,
Hafa
Happy New Year,
Health Tips, Dr. Vinny Duenas from FHP. Jay?
Yeah, thank you so much, Doc, and good to have you on. And remember, Hafa Health Tips comes to you every Tuesday right here on the link. They've got a slew of doctors down there. Each one of them is special. Each one of them very, very compassionate. Each one of them wants to bring their expertise and their true belief that you can turn your life around by making